You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with peripheral neuropathy. With us, we have an expert on the topic, Dr. Berns. Dr. Berns, welcome to the program.
Thanks for having me.
All right, now, before we get into today's topic, and we've had you on the program talking about other things that you do at your center, for people that aren't familiar with you or your center, tell me a little bit about it. I mean,
Sure.
who are the patients? And I know you do multiple things.
Right. Yeah. Well, our center is an integrated health center, meaning that we have physicians of several different backgrounds, as well as highly trained allied professionals working in a team setting. And the things that we're really best known for is going to be our type 2 diabetes program, as well as our hypothyroid or low thyroid program, and then our peripheral neuropathy program.
And people travel to see you, is that right?
They do. They travel from near and far.
You're in Tampa.
We're in Tampa, and we get people, it's not uncommon for patients to drive 2-3 hours, and we've even had patients fly in for treatment at our center.
And how do people hear about you now?
Right now, it's really coming down to word of mouth. We have so many patients that have been successful in our program that, they know, birds of a feather, type of thing. They tend to tell other people. And
a lot of testimonials, videos.
We have
patients.
We do have a fair share of those, yes.
Okay, so let's talk about, peripheral neuropathy.
Yes.
I have it right.
Yes.
What defines it? I mean, what is it? What are the symptoms?
Sure. The symptoms with the peripheral neuropathy are going to be, things like people starting to lose sensation in the fingers, the feet. Really what it boils down to is, they're losing feeling, they're numbness, burning, even like severe pain in the hands, fingers, toes, feet, even the fronts of the legs. It can even go up the arms. So these are the things that, that people suffering with this, they notice that first they start with the kind of the pins and needles, like almost it feels like it's a sleep, like when you sleep on your arm funny, right? And you wake up and it's kind of that pins and needles thing. And then it goes to numbness. And then as it progresses, then it's
always on the extremities.
Yeah, it's in the extremities, hands, feet, legs, arms.
Is that where it usually starts?
That is always where it starts.
So tingling.
Yes.
Okay.
So tingling moves to numbness. All right, then that's going to move to either burning or pain.
Now you say that you have stories where people are driving and they can't feel their feet.
Oh, sure. And people who, and those are the dangerous ones, because those folks really shouldn't be driving. But I mean, we have several patients who, their driver's license has been, they've surrendered their driver's license because they can't drive anymore, because they literally cannot feel their feet. They can't work the pedals anymore.
How big of a problem is it, by the way, peripheral neuropathy? Is that what they call it? I mean, the patient with this, what do they call it?
Yeah, they're aware of the term. It's called peripheral neuropathy. I mean, it's a well-known term in the medical community and very well known to the...
Sciatica falls into this or no?
Sciatica would be a type of peripheral neuropathy, yes. Okay. And so the people who are aware, who are suffering with it, they're very aware of what it's called, because and it's a growing problem. There's I don't know the exact numbers, but there's millions of people suffering with it in the United States. It's a real epidemic.
So are there a lot of people that have it that do nothing? I asked you that before we started.
Yeah, there are a lot of people out there who have it and do nothing, because essentially, oftentimes patients tell us that they get told that they can't do anything about it.
Does it come and go, by the way? Is it one of those things like you say, your foot falls asleep? I mean,
right. Sometimes it does. In the early stages of neuropathy, particularly, our patients will tell us that it'll kind of come and go. Maybe it'll be, maybe it's just hours, and then it's days, and then it's on and off.
Really?
But as it progresses, it does become more permanent.
Okay, so what are the current treatment options across the board?
Sure.
How is it being treated?
Yeah. Traditionally, the way that this is treated is it gets treated typically with, there are medications specifically for peripheral neuropathy. Things like, the things that patients are going to identify, medications like Lyrica or Neurontin. Those are the real common ones that probably people at home who are suffering with this, perhaps
what are those?
taking.
Like anti-inflammatories? Are they pain medications?
They're pain medications designed specifically for this problem. But
and who do they see for this? Is this their primary care doctor will prescribe this? Do they go to a specialist like an orthopedic surgeon or?
Yeah, well, oftentimes they'll deal with it with their primary care physician. As it progresses, sometimes the neurologist or another specialist may take a look at it. But what our patients tell us that is, really no matter where they're going for treatment, it's pretty much the same type of thing.
Which is what? Drug treatment?
It's drug treatment, yeah.
Okay.
Mm-hmm. And the drugs, do help to curb the pain. But as the problem becomes worse and worse, sometimes, the efficacy of those can tend to wane. And those are the patients who look up our center.
Now, what if I talk to an expert that says it just doesn't get better? I mean, it's a progressive chronic condition
right.
that doesn't go away. You say that that's not what you see.
No, it's not what we see at all. We see patients, getting feeling back, getting the pain response diminished, getting full use of their extremities again. It happens all the time in our clinic.
Okay, let's talk a little bit about your approach. Okay, so the standard approach where, to give them medications that can help them deal with and manage the pain. And what do you do?
Okay. Well, the way that the medications work is, and I think even the doctors prescribing these medications would agree with this, is they're there to modulate the pain response. They're essentially there to dampen the pain response in the central nervous system, much like any other painkiller would work. Okay. Whereas our approach is different, is that we want to look at and identify what is initially causing the neuropathy, and then we can actually go after the cause. See, what we don't do, Randy, is we don't treat symptoms in our office. We're looking for the cause, and by treating the cause is what allows us to get the results that we do.
What do you find to be the cause in most of the time?
Yeah, there's several causes with neuropathy. One of the most common ones is going to be diabetic neuropathy. With type 2 diabetes, there tends to be circulation issues. And so with the circulation issues, when the blood flow is not going there, it's not going to be carrying oxygen and nutrients to the nerves. So then the nerves in those areas do tend to deteriorate. So that's when oftentimes you'll spot diabetics, big swollen ankles or swollen calves, skin changes. You'll see that thick skin sometimes on diabetics, or you'll see like the sores on the bottom parts of their legs. Okay, those are real serious vascular issues that they're having, their blood flow issues. And then that ultimately will start to affect the nerve, which then is going to lead to neuropathy.
So some of these, also like shooting pains, you're saying. So past the numbness, I think I interrupted you, but there's pain. A lot of these people have a lot of pain.
Yes, severe pain in a lot of cases. I mean, so severe that they won't be able to wear long pants, for instance, because just the weight of their slacks on the bottom part of their legs will irritate it. When they sleep at night, horrible problems sleeping these people have. They can't sleep with covers on because just the weight of the covers touching their feet will send them through the ceiling. That's how bad of a pain we're talking about. Sometimes patients will even describe it to me as like they feel like their foot is on fire, but they can't really feel the foot.
Okay. So if this is a nerve problem, okay, so the nerves get damaged, there's a problem. Are they pinched? What are they?
Okay. Well, they can be pinched in some cases. So like in a mechanical neuropathy situation, like the sciatica that you were talking about earlier, or for instance, like a disc issue. So if you have a herniated disc in the lower part of the spine, that can cause neuropathy. Spinal stenosis, that's another way that you can have neuropathy being caused. So there's lots of different mechanisms that cause it, but then the outcome tends to be kind of the same. The symptoms are really kind of the same no matter what the initial cause is.
Okay, could you give me like a simple explanation of what you think is going on then with the nerve?
Sure, exactly.
In many cases?
Yep, no problem. So what happens is, whether it be from the vascular issue or whatever the cause is, what happens is the electrical impulse that travels from the brain down the nerves. Okay, what happens is that electrical impulse, it doesn't go all the way down anymore. So as the nerve tends to deteriorate, that nerve can shrink, and essentially what happens is our nerve system, Randy, you have to understand, it's not like we have one big long nerve that goes all the way through our body. It's a series of nerves that connect, right? And there's different cells in the nerves. So, for something to happen, like to move your foot, a message has to go to the brain down the nerve, and essentially what that message is an electrical impulse, all right? So it goes from one nerve and has to transfer to the next nerve, has to transfer to the next nerve. So as a nerve tends to deteriorate or degenerate, that gap between the nerves can become bigger. So then that message...
So what you're saying right now is, this is, nobody would disagree with this.
No, absolutely not.
Okay.
No, okay. Because we really look at it as an electrical problem. So, you have to you understand.
Interesting, okay.
Your body is essentially a big electrical system. Your nerve system, for lack of, for real simplistic terms, is nothing more than an electrical system, a very complex one. All right? So in order for things to work correctly, that electrical impulse has to get all the way down to where it needs to go.
So medication just does what in this case?
Medication is going to block the pain sensation that the patient has. So it
doesn't take care of the problem.
No, it's not going to do anything about that degenerative nerve, not at all.
So what is it you're doing that's different then?
The different thing with us is we're actually, regardless of what the cause is, we're going to tailor treatment to that to actually start to bring back nutrition and oxygen and nutrients.
You treat the nerve
area?
We're
actually trying to re-stimulate the nerves because, the great thing is, nerves in the periphery of the body, the hands, feet, those things do have the ability to regenerate if treated properly. All right, so what we're actually doing is we're trying to bring life back, to kind of give CPR, if you will, to that nerve to kind of spark it back into action.
Okay, so one of the things that you use, okay, so you have several approaches. I mean, it's not just one thing, it's a combination of things.
It is.
You put everybody on an anti-inflammatory diet is one of the things.
Yeah,
is that correct?
It's a customized diet.
Okay.
I don't want to think people think that, it's just going to be
not dieting, but I mean, you're telling them what to eat.
Yeah, we do help clean up their nutrition because, ultimately we are what we eat. So we need to have good things going into the body because it's garbage in, garbage out. So we do, we need to calm down the inflammation response in the body because inflammation is going to make the problem worse. Inflammation makes every problem worse. So, and a lot of inflammation is caused dietarily. So we customize a nutrition plan to handle that.
And they see you guys. I mean, they come in once a week. Do they come in?
They come in a little more frequently than that. Depending on the severity of the case, they'll come in multiple times a week oftentimes.
So it's a 4 to 6 month program?
No. It's a much shorter program than that, often 4 to 6 weeks. 4 to 6 weeks,
okay. So you look at the nutrition. You're doing a lot of testing. And by the way, a big part of what you do is this Neuro Electrotherapy.
Yes.
And so before we get to that, though, tell me what the testing you're doing. What other testing?
Sure. So we're going to do some comprehensive testing, looking at blood work particular, checking the inflammatory markers. Again, really analyzing anything that could be, adding to or exacerbating this problem. So is there, chronic inflammation? Is there cardiac issues? Do they have high blood pressure? Do they have lipid issues, high cholesterol? All of these different things are going to play a role into our treatment model because we need to address all of those things because, even, regardless of the cost, there's usually many things that are feeding into the beast and making it worse. So we're going to address each one of those things to ensure the patient the best outcome possible.
So are you, now what do you call yourself? Is this, integrative medicine, alternative medicine?
Yeah,
what is it?
We call it integrated healthcare. I mean, because we do have traditional medicine in the office. We have medical doctors. We have physicians of lots of different backgrounds in the office. So yeah, I guess the best way to describe it is an integrated or multi-pronged, multi-dimensional, multidisciplinary approach.
So for peripheral neuropathy, just so I'm sorry. Okay, so traditionally with medication,
yes,
to lessen the symptoms, and are they told what? I mean, just that it's not going to go away?
Yeah,
that it may work itself out?
No, it's not going to work. Usually, it's let's hope it doesn't get worse. Is the advice that a lot of our patients are telling us that they're getting.
And you say, and I have to be careful, I guess, with disclaimers, but you see reversals every week.
Every day.
Every day in your practice.
Yes.
Of people that had this tingling.
Yes.
And that tingling goes away.
Absolutely. I mean, great story comes to mind. A gentleman, he was also a diabetic, by the way. So he was 72 years old. He'd been a diabetic for 36 of those 70. So half his life he'd been a diabetic.
Okay.
Horrible neuropathy for the last dozen years. He was the guy wearing the short pants. Couldn't wear long pants.
Does it hurt? I mean, just the touch on the skin hurt?
Just to touch it will hurt.
Very interesting.
Yeah. Couldn't wear normal shoes. Had to wear house shoes or slippers.
Okay.
Because couldn't get his feet into a normal pair of shoes. Too painful. Okay. This gentleman, he couldn't drive, and after going through our program, all right, we worked with him in the diabetic program, got those issues under control, started working on the neuropathy. We're actually able to get this guy to the point where he could drive again when he hadn't driven in 12 years.
Okay.
So he came in for diabetic treatment, not neuropathy treatment. So we started treating the diabetes, okay, got that metabolic condition under control, started getting his blood sugar down, started cleaning up his diet. His energy started coming back, so then he had more energy, wanted to be more active, was able to start exercising a little bit.
Okay.
And then once we got that the blood sugar mechanism, which was really driving the neuropathy under control, then we were able to institute our neuropathy protocols on him, get full feeling back into his legs, get him to the point where he was wearing regular shoes again, and he actually was able to start driving again, which was really a touching story.
So a 70-year-old guy, neuropathy, comes in for diabetes, has all of these problems. I mean, you say it's common. I mean, it's not something I hear about.
Sure.
It's people that have tingling in their hands.
Yeah, you don't hear about it because oftentimes these people are housebound. You don't see them out and about because.
But the early stages, by the way, I mean, for professional surgeons, I mean. Very dangerous.
Oh,
obviously, when you start, scary.
Of course, it's very scary when you start to lose feeling in your hands. I mean, these are the things that, oftentimes this will lead to motor issues. If you can't feel your feet, you got to imagine it's pretty hard to walk. So then they have balance issues, and then, it's kind of a nasty progression because it starts out with, they get the numbness and tingling, and then all of a sudden, now they're having to hold on to something. For instance, they go to the store, they got to hold on to the shopping cart, or maybe they got to use like a cane, and then that starts to, that progresses even further to the point where now they can't walk. Now they're using like a wheelchair or one of the scooters to get about, and then it gets so bad that they don't even want to leave the house.
So we're going to come back. We're going to take a quick break, and I have a lot of questions about this Neuro Electrotherapy. This is the therapy that kind of gets the nerve working better?
Yeah, it's really a hallmark to our neuropathy program. The Neuro Electrotherapy is fantastic, and it's one of the things that the patients say, wow, that once we did that, that's really when I started to get the feeling
even after
back.
the first treatments, you say some people feel immediately better.
Oh yeah, oftentimes patients will say that their pain is decreased after the first treatment, and it's, almost all the time after just a few treatments, they're getting great results.
Okay, we're going to take a quick break, and I have a lot of questions about this Neuro Electrotherapy. I want to hear, what's the treatment like? How does it feel? Is it painful? What are the side effects? What are the dangers? And also, what are the frequently asked questions?
Sure.
So you're watching the Wellness Hour. We're talking about neuropathy, peripheral neuropathy, new breakthrough treatments. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you have peripheral neuropathy. Okay, so with us, and I'm calling you an expert on the topic, but this is what you do. This is what you treat at your center.
Yes.
As a recap, peripheral neuropathy.
Yes.
What are the symptoms? What are the current treatment options?
Right.
And what are you guys doing? Because you say what you're doing is different.
It is very different. Peripheral neuropathy essentially is the lost feeling in the hands, fingers, toes, feet, lower leg, even into the arms. So what happens is the patient starts to get the numbness and tingling, or pins and needles, if you will. Then it goes to numbness, then goes to pain, then goes to a burning sensation. And typically the way that these people are treated is going to be with pharmaceuticals. They're treated with prescription drugs. That the prescription drug is basically aimed at dampening the pain response. Not really fixing the problem, but making the patient more comfortable. But sometimes for these folks, the pain gets so bad that the drugs just don't work as well as they used to.
Okay, so you guys now are using this Neuro Electrotherapy in addition to other things. We should mention it's not just Neuro Electrotherapy.
No, it's one piece of the puzzle.
Okay, so tell me about that.
Okay, well, the Neuro Electrotherapy it's a big piece with our neuropathy program, because really what what it does is it's actually going to help to stimulate the nerve again. All right, so we talked earlier about how that message has to get down from the brain across the nerve. Okay, so oftentimes what happens, especially when people start to lose the feeling or the use of their feet or fingers, is that message isn't getting all the way down, okay? So we talked about how that's an electrical impulse.
All right.
So what the Neuro Electrotherapy does is it essentially sends a impulse or a message.
Is it like jolting the?
No, it's not. It's not jolting. It's a controlled impulse, but it's something. It's one that's greater than what the typical nerve impulse is going to be.
Okay.
So we talked about how as that nerve starts to degenerate, those gaps between the nerves become bigger, and that the normal nerve signal can't jump that gap. So with the Neuro Electrotherapy, what happens is, with a stronger signal, we're able to bridge that gap, which then is going to stimulate that nerve that hasn't been stimulated in so long. And that's what's really going to start to breathe life back into it, where people can start to get the feeling back. It's going to start to decrease that pain. It's going to start to, allow blood flow getting back in those areas. And that's how the patient gets well.
What about the person that really has it bad? Have you, you could work with those people?
Absolutely, yeah. There's people, obviously, we talked about the people who have, can't drive anymore. We talked about the people who, have to use the scooters out at the malls. Those are the bad patients. And we see those people every week. And these people get amazing results.
Who seems to work, who gets the best results?
Okay.
Is there a particular, is a person the early onset tingling?
Well, it's always best to to start treatment as early as possible.
Okay.
But we see that our results tend to be pretty consistent across the board.
Okay. Now this new technology you're using, it's fairly new. Is that right?
It is fairly new.
Okay. Anything about it surprised you, and were you skeptical when you first heard about it?
You know what, Randy, I was skeptical when I first heard about it, just because, I've seen, neuropathy patients for a long time, and it is a complicated process. It made sense to me on paper, the science behind it made sense, but I was still a little skeptical until I saw it in action. So once we, had some patients experience it, I wasn't really surprised by the results because, like I said, the science made sense that it would work. What I was really surprised by, Randy, was how fast it worked.
How fast? Okay, so some people, what?
Immediate.
2 treatments, 3 treatments?
We have oftentimes patients saying that they feel immediately better. Not necessarily 100%, but they get done with their first treatment and they say, wow, I feel better than when I came in. And
it's a what? Describe the treatment.
Sure.
30-minute treatment?
Okay. Well, for the Neuro Electrotherapy, it is about a 30-minute process, and then we're going to be doing some other treatment things with these patients as well. But yeah, as far as that part of the process goes, about 30 minutes. And then, it's easy, outpatient procedure. They're able to come and go. It's very convenient for the patient. There's no downtime. There's no recuperation. There's nothing invasive, no drugs, no surgery. It's really great.
Have you had people, by the way, because you say these patients are on pain medications. Have you had people that wean off or have stopped? taking pain medications?
Absolutely. I mean, we've had patients, get full use of their limbs back, and once they can feel the hands and use the hands, and everything's normal again, there's really no use for the pain medication. So they're able to go back to their physician.
So if it's as good as you say it is, and I say this to doctors across the board, if it's this good, why not hold a press conference? I guess what people don't believe it, they just don't buy it. It's it's like anything else. It just takes a while before it catches on.
Yeah, it really does. I mean, it's like any other great medical technology. As it is born into the industry, it does take several years and oftentimes even a decade or more, for it to kind of trickle down and really become mainstream. But this is not something that has never been heard of before. I mean, this is being used in mainstream clinics. This is being used at very credible places like Cancer Treatment Centers of America, for instance. I mean, this technology is used there. Okay, so in some of the more progressive medical settings, this treatment is happening. It's just not happening at all of the primary care offices.
What's your take on the cause? I mean, are we talking about what the cause is? I mean, do you guys even know what the cause is?
Okay. Well, there's several causes with peripheral neuropathy. We kind of got into that a little bit ago. So whether it be secondary to diabetes, whether it be secondary to, for instance, cancer treatment, for instance, they may have to go through chemotherapy treatment. But unfortunately, one of the side effects of chemotherapy treatment can be neuropathy.
So Cancer Centers of America are using this?
They are.
Okay.
Mm-hmm.
Okay.
Yep. And then we have the mechanical causes too, whether that be a blown out disc in the lower back, the sciatica type of patient that we talked about, spinal stenosis, those patients, like I said, really no matter what the cause is, okay, we're able to tailor the treatment to those causes. And then the Neuro Electrotherapy is going to play a role for all those patients.
Okay, so you're doing blood work, hormone panels, food allergy testing. We should mention, I mean, you're hitting this in a lot of different ways, from vibration therapies, laser therapies in certain cases. I mean, you are doing a lot of things. Yeah. But the most effective that you like, and that's one of the reasons why we wanted you on the show, is this Neuro Electrotherapy.
It is, yeah.
It's the most powerful in all of your
It's the staple. It's the staple in our program because again, we're going to employ whatever modalities or treatments are necessary based on the patient's cause. But really, all of the neuropathy patients are going to be getting the Neuro Electrotherapy. But the other adjunctive procedures that we're going to use is going to vary from patient to patient. But it's really the complete package that delivers.
Are there side effects to this?
The side effects are great health. Getting their life back.
All right.
It's, there's, like I said, it's completely non-invasive to the patient.
What are the frequently asked questions? Okay, so when a patient, because people with peripheral neuropathy, they've gone to their medical doctor, I'm guessing. Right?
Sure.
They're on medications. So what do they want to know? I mean, they must be skeptical. I mean, as I'm sitting here, I'm skeptical.
Sure.
So what do they want to know?
Well, a lot of times they want to know how it works. Okay, so we kind of take them through the same conversation we just had and explain to them essentially how the nerve system works. Okay, what happens when there's damage to a nerve?
Do you kind of reactivate the nerve?
Exactly. Like I said, I kind of joked earlier that it's almost like CPR for the nerve. Like we're breathing new life back into it. Because the nerve, as it degenerates, the nerve is still there, right? It's just not active anymore. Because as you starve anything in your body from oxygen and nutrition, it's going to wither, correct? Right? Okay. So then we're breathing back, bringing back that the nutrients and the oxygen and stimulating it and kind of bringing it back to life. That's the simplest way that I can explain.
So you said like a month's worth of treatments. Mm-hmm. They could have. Some people have had full use. No problem.
Many of our patients have
pain going away.
Absolutely.
Were you surprised? Are you ever surprised at some of the results? You say you're surprised how fast it works.
Mm-hmm. Yeah, I am surprised. I guess is how it really impacts people's lives, because really, ultimately, our treatment is really all about quality of life.
Okay.
Delivering results as fast as we can to impact the quality of the person's life as much as we can. So I guess when I see the patients, it's not so much the pain going away that amazes me, but just how their life turns around when they can golf again. They can dance with their wife again. They're able to go out and go fishing again, play with their grandchildren again. Those are the things that really surprise me, and just how devastating this condition can be, and really how fast they can get back to doing the things that they never thought they were going to do again.
So insurance covers this?
Insurance is going
to...
Oftentimes it does cover the lion's share of it. But the great thing is, though, Randy, the patient doesn't have to worry about any of those things until they actually sit down with the doctor. Because we offer a free consultation to the patient.
Is that right? Okay.
Yeah, they can come in, learn about the process.
Does Medicare?
Medicare oftentimes as well. So, what we invite patients to do is you bring your insurance information with you for the free consultation. We'll, as a service to them, we'll verify all their benefits. We'll be able to let them know exactly what percentage is covered, what's not covered. So we're happy to do that, so that we really want as as many people to be able to get this treatment as possible. So, you know, like I said, they have nothing to lose. It's a free consultation.
So why not? I mean, if somebody's suffering from this, and whatever their current treatment, if it's not working,
right,
sounds like it's worth a shot, right?
Like I said, they have nothing to lose.
But pain patients, I've talked to a buddy of mine who does pain management medicine, and he said, this is a miserable patient. This is a patient that feels lousy.
Yeah.
Their optimism has left them.
Yeah.
And they no longer think there's things that are going to work.
Yeah.
And they can be bitter.
Yeah.
So is it difficult to get them involved in the program, to get them to believe that it works?
You know what, like anything else, you know, as long as they have a glimmer of hope left, you know, that they haven't completely given up, then they can be helped. You know, a patient who is completely shut off and doesn't think that there's absolutely no hope, no one can help those
But if
patients.
Medicare and things like that are covering the majority of it, I realize you're doing nutritional therapies and some sophisticated testing, but for the neuroelectrical part, if they're covering it or covering most of it, why not? You know, I'm not trying to endorse you, by the way, but to me, I know some pain patients, and so why not? They should probably try it.
They should, because I mean, nothing's going to rob the quality of your life like being in chronic pain every day. So I mean, if that person is sitting at home listening to this right now, you know, trust me, I've seen what it can do. I know how it can just affect you, not just in pain, but when you start sitting around, you can't be active. You start to get bitter. You start to get depressed, you know, because it's taken away your quality of life. And oftentimes patients, they really feel like they're at the end of the rope when they come to us, unfortunately.
Okay.
You know, so to those patients, I invite them, come on in. You know, sit down with one of our doctors. Let's walk you through the process. You know, it's a free consultation. We'll explain everything to you before we need to go forward.
But I've had you on the show talking about diabetes and thyroid. Is your approach kind of the same to no matter what the disease is, that, you know, support the immune system, get them eating the right kind of food, supplementations when necessary, you know, really look at the underlying cause? I don't want to put words in your mouth here, but is that kind of the overall?
Well, I mean, the last thing you said there is really what it is. I mean, our approach is going to be the same in that we're going to take a comprehensive approach. The tools to get the person better is going to be different. It's going to be customized to the individual. So, I mean,
you want to find the cause. What's making this tingling?
Absolutely.
Rather than just suppress.
That's all we want to find is the cause.
Okay.
Because once we have the cause, we can treat the cause and not the symptoms.
All right. Well, I want to thank you for coming on the show. Great stuff.
Thanks for having us.
Great info. And all this is on your website.
Absolutely.
You can look that up. Spend time at your office. Well, thank you so much. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com, and you can look up, you could just, in our search, just put in Dr. Berns, and if you can spell peripheral neuropathy, we'll have it under that too. For now, I wish you good health.